Hello, welcome to Acharya Nidana Academy. In this particular video, we are going to discuss the clinical diagnosis, which is being practiced current day, that is in terms of the Western medicine, plus in terms of Ayurveda. This particular video may go a little bit longer. So when you think about clinical diagnosis, what actually clinical diagnosis refers to? When you say clinical diagnosis, it is nothing but they identify the disease or illness a person is suffering from by elaborate case history or by doing the appropriate physical examination, or plus even we are going to add the laboratory investigations which are relevant to the presenting complaint. For example, if a person is suffering from knee joint pain, then we are going to do the history taking appropriately regarding the onset, regarding the duration, regarding the character, regarding the radiation, regarding the aggravating and relieving factors, etc. When you think about the in terms of the Ayurveda, you are going to say whether it is what type of the pain it is, whether it is burning type of pain, which may indicate Pitta dosha dominance, or whether it is the pricking type of pain, which may indicate the Vata dosha dominance, or whether the pain is associated with joint swelling, which may be associated with Kapha dosha dominance. Timing of the severity of the pain, aggravation of the pain, whether the particular pain is aggravated during the morning time after sunrise, probably it may be Kapha dosha dominance. Before sunrise, there may be a possibility of the dominance of Vata dosha. So when you say in terms of the history taking in terms of Ayurveda as such. After that, we are going to do physical examination. So that means we are going to specifically examine the knee joint regarding the color, regarding the what do you say that the swelling, regarding the uh, what do you say the palpation. We are going to do whether there is any crepitus is being felt or not. After that, laboratory investigation. So we are going to do the first and foremost occasion, that is X-ray knee. Of course, other aspects such as the blood investigations that may support the findings, but when you are speaking about knee joint, the first and foremost you are going to do X-ray of the affected joint. So like that. So this is the overall gist of the clinical, the what do you say, the clinical diagnosis. So we are going to discuss in a little bit elaborate manner what are the different terms are being used in terms of diagnosis, and what are the terms are being used in terms of Ayurveda. How we are going to apply these? Okay, when you say about diagnosis, it involves 5 steps. First one, that is history taking. So that means we are going to analyze the history by taking the preliminary data such as age, gender, then name, age, gender, address, that is residential or official address. Then regarding the occupation, if he is being admitted in the ward, date of admission, etc., we are going to record in the preliminary data. After that, we are going to do the documentation of chief complaints with the duration and associated complaints with duration. So after that, we are going to see history of present illness, past history, treatment history, personal history, family history, the in case of females, menstrual and obstetric history, socioeconomical history, we are going to do in case of physical examination. After the examination, we are going to come to a conclusion that the person may be suffering from this particular systemic disease. So after that, we are going to confirm by doing the appropriate physical examination. This particular examination may be general examination as well as systemic examination. General examination in the sense, whenever if you are coming in contact with the patient, then we are going to see overall assessment of the patient regarding the nails, regarding the eyes, ears, tongue, nose, skin, then regarding the any kind of the edema is present or not. After that, the icterus is present or not. So like that, so these are the generalized informations: height, weight, then nutritional status, build of the person. All these are coming under the general examination point of view. Whereas systemic examination point of that means, so we are coming to conclusion that the person may be suffering from respiratory disease. After doing the general examination, we are straight away switching on to respiratory systemic examination, which helps in confirming or rejecting the diagnosis in terms of the respiratory disease. After that, we are going to collect all the informations told by the patient. This will be the third step. After that, we are going to select only the relevant information necessary for the diagnosis and reject the information which are not necessary for the diagnosis. We are going to reject all those. And lastly, we are going to do the laboratory investigations, maybe the invasive as well as non-invasive investigations. So thereby we are going to confirm or reject the certain diagnosis. So that means coming to a conclusion that the person may be suffering from this particular disease itself. So what is the clinical diagnosis? Different terminologies are being used. Pathophysiology refers to the occurrence of abnormal events present in the human body. Suppose if the person is taking excessive salty substances, the initial affliction will be seen in the mouth itself. And if the person is taking more amount of the spicy substances, the initial affliction or pathological events start in the mouth, but it can majorly affecting the stomach. So this is what we can say, that's about the pathological processes that can happen in the body, which may be assumed by the following, what do you say, that the terminologies. Actually, the clinical diagnosis means actually bedside etiquette. There are certain do's and don'ts that one has to follow while the clinician will be visiting or a student will be visiting the patient in the either in the OPD or in the IPD of the Ayurveda hospital. So they are anatomical diagnosis, pathological diagnosis, then hypothetical diagnosis, diagnosis by exclusion method, tentative diagnosis, and final diagnosis. These are the 6 terms that are being used by the person who is doing the diagnosis or the Vyadhi Vinishchaya. The same thing is being mentioned in different terminology in Charaka Samhita. Tasmad Vikara Prakriti Adhishthana Antara cha Samutthana Visheshamscha Buddhva Karmam Samacharet. Tasmat Vikara Prakriti Adhishthana Antarani cha Samutthana Visheshamscha Buddhva Karmam Samachare. So here 3 main terminology are being mentioned. Vikara Prakriti. So that means that is the nature of the disease. When you say Atisara, Gudena Atidrava Mala Pravrittihi, the person is passing liquid to semi-solid stools, that too with increased frequency through the anus, that is being termed as Atisara. Whenever if you are seeing this type of the presenting complaint, we are straight away making the diagnosis of Atisara. When the person is showing Deha and Manas Santapa, Deha Santapa means we are going to see the warmth of the body, whereas Manas Santapa refers to Vaichitya Aratiglanihi. Vaichitya means disturbed functioning of the mind or Sattva, Aratihi, that is restlessness and exhaustion. When you are observing this, we are going to say the person is suffering from Manas Santapa. When you are seeing Deha Santapa or Manas Santapa, or Deha Santapa and Manas Santapa, then we are going to make the diagnosis of Jwara. When the person is seeing Hritkantadaha and Aruchi, that is the Hrit, that is Hridaya Pradesha or the retrosternal region, Kantha or the throat region, if you are seeing the burning sensation and which will be associated with tastelessness, etc., then we are going to make the diagnosis of Amlapitta. Kushtha. Kushnadi Vapriti Kushtham, the one which is causing disfiguration or discoloration to the Vapuhu or the body, then we are going to make the diagnosis of Kushtha. It need not be leprosy. Most of the present day, the language, Kushta is considered to be leprosy, but that is not so as far as the Ayurveda is concerned. Then Raja Yakshma. So where we are going to see Sarvadhatu Kshaya. Sarvadhatu Kshaya means there will be the nutrient depletion of all the tissues in the body, wherein the prime factor that will be poor absorption of the nutrients from the alimentary canal. So that is Sarvadhatu Kshaya may be a resultant out of this, which may be confirmatory of a Raja Yakshma. And of course, Raja Yakshma is not a acute disease, it's a chronic disease. So like this, Vikara Prakriti. There are certain things are being mentioned which may be pathognomonic of that particular disease. That will be diagnosed by this particular type of method, that is Vikara Prakriti. Whereas Adhishthana Antara. Adhishthana Antara means we are going to see what kind of the location of the human body is being affected. So in terms of the individual organs, Vata dosha is being said that having the locations Pakvashay Kati Sakti Shrostrasti Sparshanendriyam Sthanam Vata Satatrapi Pakvadhanam Visheshatah. If you are observing any 1, 2, 3 or all the locations of these, then we are going to say the person may be suffering from Vata dominant disease. Whereas in terms of the Shadanga, whether it is the upper limb is affected, for example, in cases of Apabahuka, or lower limb is affected, in cases of what do you say that the Gridhrasi, or whether the person is suffering from the chest, that is the Uraha type of the disease, that is Hridroga, or abdomen is affected, such as what do you say that the Udara, or the Urdhvanga, maybe Netra Roga or Karna Roga, etc., which part of the Shadanga is being affected, that can be very well identified by knowing the proper case history as such, plus even physical examination. Regarding the sub part of the body, that means which particular part of the body is being affected, whether it is Netra or whether it is Karna, whether it is Nasa or whether it is the Anguli or whether it is the joint such as the Manibandha or the what do you say that the Kurparasandhi or the that is the Janusandhi, etc., etc. that is sub part of the body that has to be identified while regarding the making the diagnosis as such. Regarding the dhatu involved, what kind of dhatu is being affected? Whether it is rasa dhatu affected, or rakta dhatu is being affected, or mamsa dhatu is being affected, or meda dhatu is being affected, or asi dhatu is being affected, or majja dhatu is being affected, plus srotas affected. What kind of srotas is being affected? Whether it is what kind of the bahya srotas is being affected, whether it is the mukha is being affected, or the akshi is being affected, nasa is being affected, or whether it karna is being affected, buddha is being affected, mutra marga is being affected, or apatyapata is being affected, or the sthana is being affected. Regarding the abhyantara srotas, whether it is pranava srotas is being affected, or rasabha srotas is being affected, or mutravaha srotas is being affected. Further, regarding the srotomula, which kind of the srotomula is being affected, such as in case of the pranavaha srotas, whether it is mahasrotas is being affected or hridaya is being affected. You have to analyze all these, which may be coming under the heading of what you say that Adhishthana Antara. Third point, that is Samutthana Vishesha. What do you mean Samutthana? Samutthana means it is the actually the Nidana. What kind of the Nidana is the person is consuming, that has to be analyzed. For example, these are the examples are being quoted here. Vyayama, what kind of the Vyayama is doing? Whether the person is doing specifically the Vyayama in relation to running, the most commonly the person may be having the affliction of lower limb first. Though the effect of this particular running may be seen all over the body, but the mainly affected part that can be observed will be that is related to lower limb. Or otherwise, if the person is doing more amount of the what do you say that the writing or cooking etc., then upper limb may be afflicted for most of the occasions. Then apatarpana. What kind of the apatarpana line of nidana is person is consuming? The person, whether the person is doing excessive walking, or whether the person is doing the what do you say that the exposure to sunlight is there or not, or whether the person is exposed to the what do you say that the pachana line of treatment etc. for longer time, or whether the person is indulged in more amount of the shodhana therapy etc. And regarding the vega dharana, what kind of the vega dharana is being exposed to, whether the person is doing more amount of the chakrit vega dharana, or whether the person is doing more amount of the mutra vega dharana or ashru vega dharana. Shaitya, whether the person is exposed to more amount of the shaitya, coldness, that is residing in the cold environment or the AC room for longer amount of time. Katu rasa sevana, more amount of the pungent substances intake may be leading to what do you say that the pitta dosha vitiation. Then vidahi ahara, so that means which is responsible for the burning sensation, thirst, etc. That is vidahi ahara, which may be resulting in again vata dosha vitiation. Diva swapna, that is indulging in sleeping for longer amount of time soon after the lunch, that may be responsible for the kapha dosha vitiation. So like that, so Vikara Prakriti, Adhishthana Antara and Samutthana Vishesha will be helpful in making the clinical diagnosis. Now, regarding the further aspect regarding the anatomical diagnosis, as we have discussed earlier, regarding the 6 different terminologies are being used in terms of the diagnosis. Among that, the first one will be the anatomical diagnosis. So that means it is nothing but a reductionistic approach. So that the word reduction means we are going to narrow the diagnosis. So the human body is composed of more than 11 or 12 different systems, which may be functioning in a coherent manner. Respiratory system, which is specifically helpful in exchange of the gases. Digestive system, which is mainly helpful in the digestion of the ingested substances, which may be transformed into usable form. Cardiovascular system, that is, which is responsible for the transport of the nutrients and metabolites from one part of the body to the other part of the body. Nervous system, which is specifically helpful in transport of the millions of nerve impulses, maybe the voluntary, that is autonomic nervous system, or otherwise even the from the skeletal muscles, etc., etc. We are going to send these different nerve impulses. So skin, which is specifically helpful in the protection of the body from the external stimuli. Reproductive system, which is helpful in producing the progeny. Urinary system, which is helpful in the removal of metabolites such as the urea or creatinine, etc., from the body. So like that, the human body is having the different systems which will be helpful in maintaining the health of the individual. So anatomical diagnosis will be helpful in identifying the organ system affected. Let us say, for example, if the person is suffering from cough, sputum, nasal blockage, running nose, sneezing, hoarseness of voice, pain in the ears, heaviness of the head, etc., all that is indicative of a respiratory system involvement. That too, upper respiratory system involvement. If the person is having the pain in the epigastric region, the two burning type of pain associated with sore eructations, fullness of the abdomen, that is indicative of the affliction of upper alimentary canal. If the person is having pain in the joint, restricted movement is being observed of the affected joint, there may be a possibility of joint swelling, which may be indicative of the affliction of musculoskeletal system. The person is having increased frequency of micturition, radiation of the pain from loin to groin, pain in the lower abdomen, increased burning micturition. This may be indicative of the affliction of a urinary system. So, like this, the anatomical diagnosis will be helpful in determining the anatomical structures or the organ system afflicted. Suppose if you are even giving the more and more stress on the history itself, even we can able to identify organ afflicted also. Let us say, for example, if the person is suffering from respiratory disease and you are observing pain in the ears, which may be indicative of the connection which may be observed in between the ear and nose, that is Eustachian tube. So that is affliction of Eustachian tube can be predicted if the person is having pain in the ears associated with, what do you say, that the sneezing, etc. That is what we can able to afflict the predict the even organ afflicted. What can be termed in terms of what do you say, that from the Ayurveda point of view? That is, we can able to identify the srotas affected, whether it is pranava srotas affected, or udakava srotas affected, or annava srotas affected, or swedava srotas affected, purishava srotas affected, etc. Sroto mula afflicted, whether it is basti is being affected, then we are going to predict the affliction of a nutrava srotas. So if only basti is affected, then if you are not giving the adequate line of treatment, the other basroto mula, that is vankshana, that may be affected later. So like that we can able to predict the sroto mula affliction also. Then site of the dosha affected. It is being mentioned that vata dosha is having the pakvashaya kati sakti shrotrasti sparshanendriyam sthanam vatasi tatrapi pakvadhanam visheshatah. Whereas pitta dosha is concerned, that is the नाभिरामाशयो स्वेदो लसिका रुधिरं रसः दृक्स्पर्शनं च पित्तस्य नाभिरत्र विशेषतः. This is in terms of the pitta dosha. Whereas kapha dosha, urahakanta shirah kloma parvanyamashyo rasah medo khranam cha jihvacha kapasya sutaramurah. This is about the site of the kapha dosha involved. So like that, we have to identify even the site of the dosha afflicted there. Then, regarding dhatu or mala afflicted, which type of the dhatu is affected? Whether it is rasa dhatu affected, or rakta dhatu is affected, or mamsa dhatu is being affected, or the all the seven dhatus are affected or not. Regarding the mala, whether it is the mutra affected, or sweda affected, or purisha is being affected, or any of the dhatu mala is being affected. That is the kamala in terms of the, what do you say, that the mamsa dhatu mala. Sweda, that is in terms of the, what do you say, that the medo dhatu mala. Regarding the upadhatu, stanya and artava are the upadhatus of rasadhatu. If you are observing the affliction related to stanya and artava, then we are going to say the person may be suffering from the rasadhatu vaigunya. So like that, anatomical diagnosis, if you are planning, then these are the informations that has to be fulfilled. Here is a small pictorial representation of the srotas as such. Suppose if this is a srotas, which is having the srotamula of A and B, which is having the parts of the srotas, that is 1, 2, 3, 4, and 5. Whereas the movement in the srotas is being happening from point A to point B, that is srotamula A to srotamula B. Suppose if there is any pathogen is entering from srotamula A, then affliction initially starts at the point number 1, that is organ or avayava number 1. If the pathogen entry is continuous from the point A, then there may be a possibility of the involvement of point number 2, later point number 3, then point number 4. At last, point number 5 may be afflicted, and later we are going to see the affliction of a srotomula B. This is what we can able to observe whenever we are going to running D as far as anatomical diagnosis is concerned. Then, regarding this is what we have discussed so far. Regarding the pathological diagnosis. So that means what kind of pathological events they are going to have taken place in the human body, that we are going to look into this particular way, that is pathological diagnosis. So there are several terminologies are being mentioned there. For example, inflammatory. Suppose if there is calor, dolor, rubor, tumor, and functiolacia, that is loss of function. That is calor, that means raised body temperature. Rubor, that is redness. Tumor, that is swelling. And dolor, that is pain and loss of function. For example, let us say if there is any inflammation is happening in the mouth, that will be severe pain in the mouth, which may be associated with severe redness in the mouth. There may be a possibility of even bleeding in the mouth. Then we are going to see the huge swelling may be observed in the mouth. Then we are going to observe, what do you say, that the raised body temperature, localized raise of temperature in the mouth, plus the difficulty in the functioning of the mouth, such as swallowing or speaking, etc., that may be observed, which may be indicative of inflammatory cause. Whenever if you see the presence of fever in the body, that is usually indicative of a infective type of pathology happening in the body. Whereas congenital, when the person is having the presence of symptoms since birth, that may be indicative of the pathological diagnosis, could be congenital. traumatic. Whenever the presence of the presenting complaints observed after the trauma, such as the trauma to the back while riding the bike, etc. That is, the pathological diagnosis in that particular occasion will be traumatic. Neoplastic. Whenever the presence of symptoms are happening rapidly over a matter of 2 months or 3 months, then we are going to make the diagnosis of neoplastic. Ischemia. When there is lack of blood supply to the part of the organ or the tissue or the body, then we are going to say the person is having the ischemic type of pathology happening in the body. Hemorrhagic. If there is any hemorrhage is being happening, then that may be associated discoloration, etc. Then we are going to say there may be hemorrhagic manifestation. Pathological events are happening in the body. Immunological. The presence of lymph node swelling, the presence of what you say that the fever, etc., may be indicative of a immunological pathological events. As far as I know the point of view, we need to identify regarding the what kind of the pathological the diagnosis or what you can say the nidana is being consumed. Based on that, we can able to predict that diagnosis there. For example, vyayama janya. Excessive vyayama may lead to vata dosha dominance or vata prakopa there. That means the person may be having vata dominant disease manifestation. Similarly, ruksha guna or lagu guna or the shita guna or khara guna, etc., may indicate the vitiation of vata dosha happening in the body. Or lagu guna, snigdha guna, tikshna guna, ushna guna, etc., may be leading to the vitiation of pitta dosha in the body. Or snigdha guna, manda guna, shita guna, guru guna may lead to the increase of kapha dosha in the body. Or otherwise, ati madhura rasa sevana, excessive sweet substances intake, may lead to kapha dosha vitiation there. Excessive katu rasa sevana may lead to pitta dosha vitiation or vata dosha vitiation in the body. So, sharad rutu janya. So that means when the person is having the what do you say that the worsening of the symptoms, specifically during the sharad rutu, probably in the month of November or so, October or November, then we are going to say there may be a possibility of pitta dosha vitiation. Or we have to identify whether it is avarana janya or dhatukshaya janya. So whether the person is obese or emaciated, whether it is emaciation in the sense what kind of the dhatukshaya is being observed, whether it is rasakshaya, whether it is mamsakshaya, whether it is medakshaya, astikshaya, or shukrakshaya, etc. That has to be very well identified. So this can be diagnosed with the help of this particular type of the pathological diagnosis or etiological diagnosis. Third one, that is hypothetical diagnosis. What do you mean by hypothetical diagnosis? The term hypothesis means we are going to make the hypothesis based on the descriptions told in the text or the Ayurveda textbooks. By mixing the features mentioned in the textbooks and matching it with the descriptions told by the patient can be done by the help of hypothetical diagnosis. Let us say, for example, 25-year-old female patient presented with the presenting complaint of multiple symmetrical joint pain, that to smaller joint affliction, which is associated with morning stiffness and joint swelling, may be helpful in the diagnosis of rheumatoid arthritis. These are the clinical manifestations told in the textbooks of clinical medicine, and these are the presenting complaints told by the patient also. Then matching these clinical features mentioned by the patient as well as mentioned in the textbook, we are going to make the diagnosis of rheumatoid arthritis. 40-year-old male presented to you with a history of retrosternal chest pain, burning type of pain, worsens on consumption of spicy substances, associated with sore erectations, orbital erectations, getting relieved by taking the antacids or pitta shamaka medicine, then we are going to make the diagnosis of a amla pitta or acid peptic disease. Similarly, when the person is having cough with a pink sputum, which is being associated with visible jugular venous pulsation on the right side, pain in the right upper quadrant, and ascites, loss of appetite, nausea, bilateral pedal edema, etc., are confirmatory of a diagnosis of congestive cardiac failure. Whereas the person is having the discomfort present inside the body associated with less presenting complaint of thirst, etc., and perfectly healthy looking externally may be helpful in the diagnosis of what you say that's antarvegi jwara. Or when you are observing durgandha harita shavata of the pitta and amla rasatva, amlika, that is sore erectations, kantahriddaha, may be present in the diagnosis of the samapitta. So altogether, when you are looking into the hypothetical diagnosis, we are going to see the clinical features told in the text and matching those with the what do you say that the patient as such. That means we are going to see from the library side to the bedside. So that is what we are going to make the diagnosis in terms of hypothetical diagnosis. When you say about the fourth method, that is diagnosis by exclusion method, let me give you the description by giving the one presenting complaint, that is chest pain. Whenever chest pain is being present, which may be observed in respiratory disease, which may be observed in cardiovascular disease, which may be observed in alimentary canal disease, which may be observed in musculoskeletal disease, which may be observed in neurological disease. Then if you are seeing the patient or presenting with chest pain, you're going to make all the diagnosis? No. Depending upon the location, depending upon the radiation, depending upon the aggravating relieving factors, depending upon the nature of the chest pain, etc., we are going to make the diagnosis of the different systemic diseases. Suppose if this is a chest and if this is the sternum, and if you are observing the pain on the either sides of the chest and that worsens on coughing, that is usually indicative of a respiratory disease. When you are observing the pain, that is the retrosternal pain, which is radiating towards the left axilla, sometimes which may be observed even in the left hand till the left fingers, then we are going to make the diagnosis of cardiovascular disease, specifically cardiac disease. Suppose if the person is having the presenting complaint, which may be considered to be present in the retrosternal region, which is having the association with food intake, that means aversions on consuming the food, which may be indicative of a alimentary canal disease. Suppose if the person is having the pain on the specifically he can able to identify the exact location of pain, and such as this particular region or this region, and which is specifically seen on change of posture, that is usually indicative of a musculoskeletal disease. And when you are seeing the pain, which is considered to be the dermatomal presentation, so and which is characteristic feature of this particular pain, which will not crossing the midline, that is usually indicative of a neurological pain. Neurological pain. This is how the diagnosis by exclusion method will be helpful in making the diagnosis. The fifth term, that is tentative diagnosis. Tentative diagnosis means we are going to take the history, elaborate history, we are going to do the physical examination, and we are making the diagnosis of the disease by this. Then we are going to say it could be a tentative diagnosis. And final diagnosis means what? We are going to take the history, elaborate history, and we are going to do the necessary physical examination, and we are going to make the diagnosis. After that, to confirm the diagnosis, we are going to do the laboratory investigation, such as the blood test, or urine test, or the ECG, or the X-ray, or the CT scan, or MRI scan, or the angiogram, or Doppler study, etc. We are going to, or the ultrasonogram, we are going to do the different laboratory investigations and imaging. After that, we are going to make the diagnosis. Then that is being termed as final diagnosis. So the take-home messages are: the diagnosis is the one which we are going to make the which we are going to make the diagnosis after doing the history, physical examination, etc. Diagnosis involves 5 steps: history taking, physical examination, and collection of the data, all the data. Then 4th step, selecting the relevant data and rejecting the irrelevant data. 5th one, by doing the necessary laboratory investigations or the imaging techniques. The same thing is being mentioned in a different way. Tasmat Vikara Prakriti Adhishthana Antara Samutthana Vishesha Buddha Karmam Samachare. That is, Vikara Prakriti, identify the Vikara Prakriti, identify the Adhishthana involved in the patient, and identify the Samutthana or Nidana afflicted the human body that has to be checked. As far as the present day, 6 different terminologies are being used while making the diagnosis: anatomical diagnosis, pathological diagnosis or etiological diagnosis, third, hypothetical diagnosis, diagnosis by exclusion method, then tentative diagnosis, and final diagnosis. That's all for today. Dear members, what are the major key takeaways from this particular discussion? Mention in the comment box below. And what kind of the topic would you like to hear in the coming session? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.